Hi, Sarah. I'm just waiting for Sarah Pinkhasov, the speaker, to join.
Okay,
Thank you for coming.
you're welcome. Thank you for hosting it.
Sure. Hi, Sarah. How are you? Good to see you.
Hi, how are you?
Good to see you. How is everything?
Everything is great. It feels so amazing to be back. It feels like such a full circle moment right now.
Love it. Thank you so much for coming. We're excited. So
Yeah, for
I
sure.
don't know if I'm going to be able to stay the whole time, but will I am going to make you the host. Let me
Mhm.
just see here. Still letting in students, and then I'll probably make you the host in case I need to leave before you're done. But it's great to
Yeah,
see you.
sure.
I'm glad you're doing so well.
Thank you. Thank you. Yeah, you also helped a lot in my journey. I remember going through all the application with you and helping me with the edits. So you are also a part of the journey.
My pleasure. All right, so we have a nice turnout, which is great. Um, Hopefully students will feel comfortable, putting their cameras on so you can actually speak to real people, real faces.
Yeah. I'll be
Uh,
sharing my screen though, with my presentation, so I'll probably just be looking at that.
okay, that's awesome. Let me make sure you're multiple. Okay, and then let me just make sure you are the host here. Okay. So now you are the host. So in case I need to leave a little early.
Okay, sure, no worries.
So
Do you want me to admit these people as well
sure.
to help you out? Yeah.
Yeah, because I see once I made you the host, I don't think I see those additional people popping up.
Okay.
And whenever you want to get started is really fine with me.
Awesome. Let me go ahead and share my screen then. Second. Oh, am I going to keep getting these pop-ups of like trying to admit people in here?
Yes, it's probably, you will get those. There are probably some additional people trying to get in.
Okay.
It shouldn't be too much longer because they know it starts at 7:30.
Okay, no worries.
Okay.
So should we wait a little longer or can I start?
You can, I mean, if you want to wait one more minute, it's really up to you. But like after another minute, I think whoever's there, I think is waiting and eager to hear you speak. So you can start after that.
Okay, awesome. Alrighty, so hi everyone. I'm Dr. Sarah Pinkhasov. It really feels great being back. I remember my whole journey started at Hunter and starting the pre-optometry club and talking to students then, and now being back as a doctor, it really does feel great at the moment. So thank you guys for having me. So myself, I went to graduated in
Sarah, I'm so sorry to interrupt. So for some reason, I don't know if your voice is coming through. It seems a little like you're coming in and out. So I don't know
oh, it's the case.
where if it's your speakers but
I don't even know what to do to fix that.
okay, now it sounds better. Maybe when you get closer to your mic, it's better.
Oh, so you want me to bring my, I can do this. Is that any better?
That's great. Great.
Okay, cool. So yeah, I graduated in Hunter, May 2017. I continued my doctorate degree at SUNY College of Optometry, and I graduated there May 2021. So right now I'm practicing at New York Laser Vision. This is an ophthalmology optometry practice, and here I get to do full scope optometry, specializing in myopia management, working with specialty contact lenses, and then also working alongside an ophthalmologist. So we do a lot of pre and post-op consultations there as well. So really loving my experience here. It's really full-rounded. So let's get started from the beginning though, and why I chose optometry and how my whole journey started. So with me, I always had some sort of connection with optometry and with my optometrist because I have really poor vision. I'm as high as like a -9 in both eyes. So I would always go to my eye doctor. And I remember one of the worst days of my life is when I lost my glasses and I couldn't see anything. And then going to my doctor's office, getting that something as simple as just getting glasses, he not only improved my vision, but my overall quality of life. So that was already my first inkling with the field. But after I graduated high school and started college, I was thinking, I knew I wanted to go into the medical field, but I wanted to determine like what's the right field for me. And one thing I advise everyone to do is definitely go shadow and try to see firsthand if this is the right profession for you. So one of the first optometrists I ever shadowed afterwards was a vision therapy specialist. So at his office, he didn't even have any glasses or contacts. It was just a pediatric clinic where he was doing vision therapy. So what that experience showed me is that optometry is way more than just selling glasses and contacts, but there's so many different things that I can get into. With vision therapy, I learned that people can see 20/20, but still have various different issues with their eyes, such as having a lazy eye or convergence insufficiencies. So there's different vision therapy exercises that we can do with them to help improve their visual brain processing system. And then from there, that led me to start to shadow various other different doctors in ocular disease, glaucoma, specialty contact lenses, and just going through that whole experience that really showed me that optometry is so versatile and there's so many different, I'm not going to be just doing the same thing over and over again. There's so many different aspects to optometry that really then just enticed me. So like I said, one of the main things that really solidified why I wanted to do optometry was physically going and shadowing different optometrists. One thing that I want to just stress is important is try to shadow optometrists in different modes of practice and specialties. So not only do you want to shadow different specialties like vision therapy or glaucoma, specialty contacts, but also look at different modes, like go look at various how private practice is run versus how optometrists work in a hospital setting versus a community center or an industry in the corporate world. So being really reflective is important as well. Try to really determine what these shadowing experiences have taught you and what you learn from these experiences, because that will really make you see if this is something that you want to do for the rest of your life. So just a little bit about my pre-optometry experiences. So it's really exciting that I was the person who started the pre-optometry club here at Hunter, and this was really a rewarding experience for me because it really taught me how to start something from the ground up, and it instilled those leadership skills in me, and that's was really important because it really taught me what it meant to be a leader. And as doctors, that's what our role is going to be, to lead, make sure that we're picking the right diagnosis and treatment options for our patients. So trying to get into various different leadership roles and positions will be very helpful during your pre-optometry journey. Some of my other experiences being part of the pre-optometry club was raising awareness about eye and organ donation. We taught me how to delegate different tasks, getting into speaking with various admissions counselors, organizing events and everything. So that was part of what it meant to be part of the pre-optometry club. Some of my other experiences during my pre-optometry journey was being part of the CSEP spring internship at SUNY College of Optometry. And for anyone who is a candidate, I highly, highly recommend this program at SUNY. So what this essentially is, there's two different internships. So there is a spring internship that's more so just a few weeks. And what's really cool here is you get to go to SUNY and you get to shadow all of the different clinics there, looking at the low vision clinic, contact lens clinic, pediatric clinic, vision therapy clinic there. You get to hear various different lectures and talks from different doctors. So you really kind of have a different view of what optometry is like and what it may be to be potentially a student there someday in the future. One aspect of this program was there was also a research component associated with it. So you would work alongside a partner, and one of the tasks was to present on a certain research topic. And the topic that I chose was the convergence insufficiency treatment trial. And we basically presented about what the research was about. So it really helps you learn more about optometry. And what was cool is that this experience, my partner and I, we ended up winning the research competition there. And we were able to then go to the research conference in Saratoga Springs and present there. And that experience then helped me network with so many other different medical professionals there. So if you are a candidate, I highly would recommend to apply to this program. There's also another winter internship program or some other more academic-like where it's more so just taking classes. And this can actually also earn you credit so that you can then apply it once if you ever go to SUNY. But also to not, if you don't get in or if you're not a candidate for this program, don't be afraid. If you still want to get that experience of seeing what it's like to specifically be at SUNY, reach out to some of the faculty there, email them and see if you can potentially shadow them. Some other things I did was volunteering at the New York Hospital of Queens Eye Center. So it helped me see what it was like to be an optometrist in a hospital setting. And these are just some of my other shadowing experiences I did. I went to a low vision specialist at the Helen Keller Services for the Blind. And what was really cool there is that I was able to see, before I had the misconception that being blind meant you couldn't do anything and you were just like impaired. But there are so many different resources available to patients who are legally blind. And it was really cool to have that experience. So as you can just see here, my shadowing experiences, they were in like various different fields. So it really just made me more well-rounded and more aware about the profession, and really help you see like what impact optometrists really have on people's lives. So extracurriculars are important. Oh, one thing I did want to say is optometry is a state legislative profession. What that essentially means is the way we practice is controlled by what laws are passed in each state. So I don't know if you guys know this, but New York was one of the last states to be able to allow optometrists to prescribe oral medications. And in order to have had to allow us to do that, we really needed leaders and optometrists to go fight with Congress, fight with various different people to pass this bill in order to allow us to prescribe these oral medications, because we just better can take care of our patients being able to prescribe them these medications that they need. So just understanding that leadership and being involved is important. So going into more about my pre-optometry journey, one of the big things was also taking the optometry admissions test. For me, I took it in between my third and fourth year. So that summer is when I started studying for it. The way I studied was I took the OAT Destroyer, I took the course in Staten Island, and I also just books and just did as many practice questions as I could. I also used Chad's videos for the physics component, but there's so many other resources out there that you just have to determine which one works best for you. So the next step was, once you pass OAT, go through the whole application process, the next step is the interview. And I don't know how it is in other optometry schools, but a little bit about SUNY, the way it works is there's usually 3 different doctors there, and it's just you. So sometimes that can be intimidating to some people, but they're really just there to get to know who you are and see like how aware you are about optometry and why you want to go to the specific school. And it's really just important for you to also determine if optometry is the right profession for you, because once you get into school, it's very demanding. So you want to know that you're really passionate about this field before having to go through all of this work and then realizing that it's not for you. So with the interview, just be prepared, go review your personal statements, and just be honest and authentic, and try to have fun as well. So a little bit now about my life as an actual SUNY optometry student. One of the biggest learning curves that I had to learn when getting into optometry school is that the amount of classes that we have to take per semester was much more. So I had to be prepared to change my study habits. Back when I was at Hunter, the way I used to study was I would have to like handwrite all my notes, and just that was the best way I studied, was doing everything by hand and making flashcards and everything like that. But then coming to optometry school, with the amount of information that we had to know, it just wasn't time-wise so feasible to do that. So I had to learn to change up my study habits. So just want to foreshadow in the future, you may have to adjust, so just be prepared to do that. What's also really amazing though, once you're already in optometry school, it's really not about grades anymore, but it's more so about the networking and the people and relationships that you formulate. Of course, it is important to make sure you pass all your classes so that you can continue on to the next step, the next year. But it's also really important to make those connections. Optometry, it's a very small field, so in the future, the people that you meet in optometry school, they're going to be your colleagues. You can learn so much from them. So don't get stuck in the tunnel, and just important, again, get involved, when I was at SUNY, I was part of the New York State Optometric Association. I was the treasurer there, and then I was also part of the private practice club there. So it really exposed me to various different doctors and really forming those relationships. Okay. Oh, I know this is a little bit of an overwhelming slide, but just for you to kind of see how many classes we take and what to expect going forward. These are, it's all on the website too, but this is specifically for SUNY, all the different classes that we're expected to take. Between the first and second year, we have that summer off. But then after that, it goes straight from second year to third year. We have like a week or two in between, and then we go through our summer, fall, winter, and spring quarters. And then our last year, our fourth year, that's the most exciting because that's when you start to do your externships. So for me, the externships that I did was I first did SUNY in-house. Essentially what that means is you're in the school, you rotate through all the different clinics there. And then I moved on to East New York. That was a community health center there. Then I did a pediatric rotation, and then I went to a private practice at Cooper Eye Care. So what's really amazing about SUNY is they really want to make sure that you have a very well-rounded experience, and you already start shadowing and being in clinic first year. So you already get that exposure from first year and moving on to second year, and third year, you're already also seeing your own patients. So they're really there to make sure you're prepared for clinic. And what's important is having that well-rounded experience. Those are just a few pictures about, like, it's not all hard work. You do have fun in optometry school as well. This is like a networking with doctors event, vision therapy, vision expo, where you go to the Java Center, see all these new technologies, go to all these different lectures to learn more about the new and innovative things in optometry. On the bottom right, it's a picture of us at the eyeball. Essentially what that means is we have like these, after the end of midterms or finals, we have this event where we party, we dance, and it's fun too. We don't just study all the time. So now a little bit about life as a doctor. After all that hard work, everything has finally paid off. And what's so amazing about optometry is we really have a beautiful work-life balance. And it is a very fulfilling profession. You form these amazing doctor-patient relationships, and you're really positively impacting patients' lives. Even something as simple as helping someone with their dry eyes. Dry eyes is a really chronic condition, and it really, especially now with the excessive amount of screen time that we have, people are really suffering. So trying to help treat the underlying cause of what's causing the dryness and helping them feel better and treating their symptoms can really go a long way. Some other just positive impacts that you also will have on patients' lives is what's so amazing about optometry and just being an eye doctor is the eye is literally the only organ that we can see inside of your body with live blood vessels without having to cut you open. So you can diagnose patients just by looking at their eyes. For example, you can see if someone has high blood pressure, diabetes. One really a little bit sad but interesting case that we had was I went to a patient and they were coming in complaining of headaches, and they started to hear ringing in their ears, and they were starting to have blurry vision. So they thought it was something with their glasses. Their glasses weren't the right prescription. But then after doing a dilated fundus examination and dilating their eye, looking at the back part of the eye, we saw that their optic nerve was very swollen. So we had to refer it to MRI and CT scan. And we essentially saw that there was a tumor growing on their pituitary gland, which was causing this headaches and causing their peripheral vision to start to be affected. So you can really save lives being an eye doctor. So it's really rewarding. It's really amazing in that sense. A little bit about what I did after school was, so right after I graduated was in May. So there's a little bit of time before you have to wait until you officially then get your license. And then what I initially did is I was working in various different part-time optometry practices before I determined like where I want to work full time. So what's so amazing about being an optometrist in New York, I don't know how it is in other states, but there really is a high demand for optometrists, but a very low supply. So we really can pick and choose where we want to work. There's always going to be opportunities for us. So in the beginning, I was doing a few part-time jobs, try to see which modality I like the most here and where I see myself growing the most and enjoying my time. So I did a few part-time jobs, and then I ended up going full-time to work at Amplify Eye Care. So this was a vision therapy and myopia management practice. Here I was able to work with a lot of children and really help with their eye teaming skills and with myopia management. Essentially what myopia management is, it's trying to help slow down a patient's prescription while they're still young. So we get to work with specialty contact lenses and ortho-K lenses. Just another story of like how rewarding optometry is. I would have patients. I once had this little boy. He was an 8-year-old Asian male, and he was coming in a span of a very short amount of time, his prescription progressed by 1.5 diopters. And that's a lot for kids, especially that age, and in such a short amount of time. So we really want to help slow down the progression, because not only is having a higher prescription worse kind of quality of life because you're seeing everything blurry, but you're also more at risk for various different ocular diseases like glaucoma and macular degeneration the higher your minus prescription is. So we fit this patient into an ortho-K contact lens. Essentially what that is a specialty hard lens that we place on the eye, and it helps to reshape the front of the eye to essentially slow down the progression. And as we were following him, he really, it really helped slow down his progression and really helped to stabilize his myopia. So the fact you can impact little kids' lives like this and know that you're preventing different eye diseases down the road is also really amazing. But what happened with Amplify Eye Care is I was there for about a year, but then that location they had to move, so they closed down. So then I moved to New York Laser Vision Manhattan. So that is actually completely different. It's I'm working now with an ophthalmologist, so it's an optometry practice, but I still get to do very full scope optometry there. Still get to do the myopia management. So this just also shows you in the short amount of years that I was out of school, it's very versatile. You're constantly doing something new every day, so you won't get bored. And what's also important that I want to mention is in between when I finished Amplify Eye Care and then went to New York Laser Vision Manhattan, I was doing fill-in opportunities. So while you're looking for your full-time dream job that you want to stay at, you're not jobless. There's so many different opportunities. Constantly people looking for optometrists to fill in, whether it be in like random opticals. You're not going to remain jobless. It gives you that space of trying to determine what's the best fit for you, while still, being able to make money and having through these fill-in opportunities. So overall, highly recommend optometry. I really love doing what I do. And although I know the whole journey can be a little overwhelming and there's a lot of different steps to get to then a doctor, just know that it is all worth it, and it is a very fulfilling profession. Just make sure you put in the work, shadow patients, and see if this is really something that you want to do. And that's the end of my presentation. You can contact me. Here's my email address. And if anyone has any questions, I'll be happy to answer them. I think someone asked me a question actually. Can you tell me about your optometry school tuition and how long does it take to pay off loans? So with SUNY, I believe it was about like $30,000 a year. I think it's already changing at this point. But that's what SUNY optometry was. And what's actually pretty cool is the first year, if you do really, if you have like a good application, they do give out incentive scholarships. So that did help me out a little bit, that I was able to get an incentive scholarship for the first semester. So see if you can apply for that as well. And then we're still in the process of paying off loans. So there's a special financial aid advisor there. Vito, his name is, so you can, he's always available to talk. And if you need any help with loans and tuition, or if you have any questions ever, I'm sure you can email him and he can guide you through that. Does anyone else have any questions? Namira.
Hi,
Hi, Namira.
thank you so much for the seminar. I just wanted to say that I'm from the e-board of the Hunter Pre-Optometry Society, which we know you
Oh.
founded. So thank you so much for
Oh.
that. I just
I'm
wanted
so
to give you a
happy
shout
that
out for
it's
that.
still running. Oh my God, I'm so happy it's still running. It really like warms my heart that like, I was able to start something and it's like still
Mhm.
functioning, and great job for upkeeping it and all of that. So props
Yeah,
to you
it's had a
guys
huge
too.
impact on us. Like we're all really lucky to have somewhere we can like contact each other for networking opportunities and all of that. And we just want to say that we're available if you ever want to stop by. We always have a
Aw,
home for you.
thank you. That was really sweet.
Mhm.
I'm really happy it's still going and you're doing a great job. It is a really great opportunity. You meet all these
Mhm.
pre-optometry students. You also meet all these different admissions advisors, and it really teaches you, how to organize events and everything. So great job.
Mhm. Thank you.
I think I have some other questions. Christina Jing, hi, I have two questions. First is, can you share some study habits or methods that helped you the most? Okay, so study habits and methods that helped me the most. So in optometry school, like I said, the amount of information was really overwhelming. So I couldn't do the typical handwritten notes that I was used to. So what really helped was different study guides that I made to try to kind of like organize all of the notes so it's in a more coherent fashion, because professors would have like hundreds of slides on their PowerPoint. So making study guides where it was more coherent and just putting all of that important information, that helped me. Using also this, it's called Anki. It's kind of like this flashcard online website thing where you can like write out questions or flashcards, and then it's a program where um, what's cool about it is that typical like Quizlets, you kind of just like have a flashcard, and then if you get the answer right, you move on and then never see that flashcard again. But a lot of understanding and memorizing stuff is like you have to kind of see the same thing over and over again. So what's cool about the Anki program is that after like a few cards, it kind of the same question pops up again. So I really did like Anki. That was like one of the other study mechanisms I used. What's also really cool is the year that I was at SUNY, I had a very, I don't know if I'm lucky in that sense, but I had a very friendly class. So we all like just shared each other's study guides, working in groups, like testing each other out also helps. So like um, talking through certain points. Like if you can teach somebody else the topics, then you know that you know the material. So also after studying on your own, having group sessions to kind of talk it through and asking people questions, that also helped me. Like I would study on my own, and then I would get together with the group and try to see what we know and don't know, and then asking other people. And then how did you balance your personal life and school life? So yeah, some at points that during midterms week and finals week, that everyone knows it's like so hectic, back to back finals and exams. But what is great is that you have like the weekends to catch up on all your work. Never one thing that patients may, not patients, students may feel is like we kind of get overwhelmed because we kind of feel like we're behind, but just know that, you know, you have the weekend to catch up, and just know that, like, it's okay to take breaks. Like, if there's a certain day, like, you don't have to study every day in order to then make sure that you do well on the tests. Just if you're having like a day where you're just not feeling so well, like taking that mental health day, I remember I would like go to the gym, I would do yoga. That really helped calm me down. Meeting up with friends, I made sure that I incorporated that. Like, for example, right after a midterm, you don't have like that much material to start studying for again. Like, the next test is in like weeks away. So making sure that I treat myself, I reward myself, that allowed me to help me keep going and give me that energy and fuel. So it is a lot of work in optometry school, but it's doable. It's manageable for sure. You have time for yourself. I'm just making sure that you prioritize that and don't feel guilty for taking those breaks. Like, you have to make sure you give yourself the time to like refuel your energy so that you can keep going. So how was your undergrad and OAT experience? So undergrad, I mean, it was it was great. Obviously, we know like Hunter, they have like beginners classes, like 800 students. I came from a high school where the whole graduating class was just 56 students there. So I came from a very, very, very small high school. So then going to Hunter, that was also like a adjustment for me during my undergrad experience. But I just made sure, you know, to go to teachers' office hours, form friends in my classes where we can help each other and work off of each other. It really helped me to, you know, do well in undergrad, and just don't be afraid to ask questions from your teachers, because I understand what it means to go to Hunter where we feel like sometimes we're just a number in like a classroom. So don't be afraid to go to your teacher's office hours, ask the TAs questions. And overall, I did like my undergrad experience because I was able to, part of it was being part of the pre-optometry club, and that was one of the great factors about my undergrad experience. OET experience, that was, I remember that summer was, it was really just devoted to studying for my OETs. It was kind of, as much as it was kind of easier because I did it with a group of friends where we went to the OET Destroyer classes. And the friends that I formed there, we all ended up getting into optometry school. So we're still friends up until today. So as challenging as the OET experience was, the fact that I was able to do with other people made it a little bit easier. The main thing I recommend is just trying to do as many practice questions as you can. So the OT Destroyer has a lot of those practice questions. And then I remember I used Chad's videos for the physics component to just kind of get a better understanding, because I remember at that point, I don't remember if I only took physics 1 or something like that. I had to still retake another class in my 4th year before that. So I just wanted to make sure I got more of that knowledge. So Chad's videos really helped me. But again, there's so many other resources, so you just can find out what works best for you. I know some people use Kaplan and stuff like that. What type of doctors would you recommend to shadow, and what extracurriculars should we consider? So type of doctors, I would shadow basically different modes and different specialties. So you can go ahead and shadow like a primary care optometrist, and then try to find maybe a doctor who is like an optometrist and MD doctor, and working in a group setting like that. So what does it mean to work in a group setting versus in a private practice? Try to shadow maybe a doctor in a hospital setting, like Mount Sinai Eye and Ear, or Bellevue Hospital. They have optometrists there as well. Try even a doctor in optical, see what that's like. Just my main advice is don't be afraid to reach out. The worst that they can say is say no, that you can't shadow them. So just reach out to even doctors around your area where you live. Like if you see an eye, like an optical, or see a private practice, and you just want to say, come in, say, I'm a pre-optometry student, I want to learn more about optometry. Would you mind if I come in and shadow you for a day? And then maybe that day can turn into weeks or on a consistent basis. Actually, I remember when I went to that vision therapy practice, I also like was calling him. I didn't really get much. I never got a response, but then I went to him in person, and then I asked him like, "Oh, I really want to come and shadow you." So I was going to him on like a weekly basis, and then he ended up asking me if I want to work for him like as a receptionist there. So just don't be afraid to put yourself out there in regards to the shadowing experiences, and the worst that they can say is no. So then you just ask somebody else. I think even the SUNY, they have a list of optometrists that you can contact and shadow them. So just try to call whoever is like living around you or wherever is convenient to go and see if they can accept you to shadow. And main thing is when you do go shadow, just be reflective. Bring a journal where you can really write about what your experiences were and like really think about what did you learn, like what didn't you know, and then what did you learn from this experience. Extracurricular, should we consider? Well, like I said, I really recommend C-STEP if you guys are candidates for it. I really did like that program at SUNY. But even just being involved, the fact that you're here today is awesome. That means you're part of a club. Extracurricular, some like volunteer work. I know like Contra, the pre-med or optometry, we offer different volunteer work that you can do. I remember one of the events that we held was like donating used glass. So just being involved, being part of different clubs is what I would recommend. Different jobs also, you can maybe work for an optometrist, like as an optometric tech, and see what it's like to be in the field and all that. So one place I would recommend is like Fromer Eye Center. It's like an ophthalmology practice. They do hire a lot of optometric techs and students there, so maybe consider that as an option. Do you have any advice for students who work full-time and are on the pre-med track? I'm struggling with passing Orgo 2 in this winter. I'm taking third time around taking the class and I am getting discouraged. Yeah, Orgo is definitely a very difficult class, so you are not alone. What I would recommend is really really going to the professor there and just asking them all the questions that you have. Don't be afraid to, there's no such thing as a stupid question. You're spending money to go to school, so don't be afraid to use your resources. Maybe get a tutor there. I'm pretty sure Hunter offers different tutoring sessions with different TAs there. So maybe grab a tutor there and maybe review your old previous test and see like what you are getting wrong and where you need like where you need to improve. Do you have any advice for students who work full time? Yeah, that can definitely be challenging. Like I didn't work while I was in school, so it did allow me to just like devote my whole entire time to school. But if you are working full time, I know everyone has different responsibilities outside of school. I would maybe recommend not taking them so many classes so that then you're not feeling so overwhelmed and just trying to really do well in like the small amount of classes that you're taking instead of trying to take so many classes all at once. Are there any residencies in optometry? Yes, so there are residencies in optometry. It's a 1-year optional residency, so not everyone has to do it. You're already considered a doctor after you graduate, so it's not mandatory, but there are residencies. And there's all different types of specialties. You can get into a pediatric residency, you can get into ocular disease working at a VA, you can get into a specialty contact lens residency, you can get into a low vision residency, you can get into glaucoma ocular disease residency. There's a lot of different specialties all around the countries that you can get into. And usually if you want to do a residency, almost always you'll get into a residency. Like you may not match with your top choice, but there's what we call a post match, where even if you don't get into the residency of your choice, at the post match, there's certain residency spots that don't get filled, and you can you can then it's called post-match with that program. And almost always at the end of the day, if you want the residency, you will get it. What do optometrists do other than contact lenses, eye exams, and glasses prescriptions? So vision therapy, that's one thing that we do. So what vision therapy is let's say someone has like a lazy eye, or their eye is turned outwards and they're constantly seeing double, or they're in school and they're a kid and they're constantly losing their place, they have difficulty tracking. So we as optometrists do various different eye exercises with them to try to help reprocess that visual processing system and help to retrain that so that it's a skill that they learn. So essentially when we do various different tasks, it's not really our eyes that see, but it's more so our brain that has to process the information that's coming in through our eyes. And a lot of people with binocularity issues, they're having issues with that processing system. So doing various different vision therapy exercises is something that we do as well. So if you're interested in other stuff like that, I would go and shadow a vision therapist to try to see other aspects of optometry. Optometrists also, they do ocular disease. So they may be working at a glaucoma clinic where they're working with very type of advanced retinal diseases. So you can try to look at various different retinal specialties that you can get into. There's also low vision specialties in optometry. So it's working with specifically blind people and various different, providing them with various different machines and devices like telescopes and CCTVs, working with them to try to help manage their lives and cope with certain retinal diseases where they're just not seeing clearly. So going into the low vision practice as well, there's a lot of different things you can do. So we don't do the same thing every day. No, like right now, I see like I'm in a optometry ophthalmology practice there, and like every patient is different for me. Like I can see a kid who I'm fitting in ortho K lenses, and then I can see a 7-year-old coming in for a diabetic eye exam. I have to dilate their eyes and see if we need to do any injections into their eyes. What's also really cool where I'm working right now is it's also aesthetics. So I get to do then IPL procedures and to try to help treat their dry eyes. And there's so many fields you can get into, and optometry is constantly evolving. There's constantly new technologies coming out. So you're not gonna. I don't even, half the patients I see, I don't even give glass. I don't refract if they already had a glasses prescription. They're coming in for other conditions, coming in for dry eyes. They're coming in for they got an eye infection. They got a scratch in their eye, so you have to help treat them like that. So I see within the day, I can see like so many different variety of patients. Of course, it also depends where you go. If you go to an optical, that's more so of just, that may be just more glasses and contacts. But if you want to do more of medical optometry, there are options like that. You just have to pick the right place. Do you want to do the same thing every day? Are you satisfied with your salary? Yes, like I said, you do have, the demand is much higher than the supply. There's not a lot of optometrists in New York. We only have one optometry school, and half of the people there are out of state. So you really do get to pick, and this gives you power to then negotiate with your employers. Like when you go to an interview, not only are they interviewing you, but you got to interview them and see, can this be my potential employer? Am I happy with this working environment? So does the salary differ based on percentile? So what do you mean based on percentile? Salary difference. Like it differs where you go for sure. Like for example, one location versus another location can be very different. Optical setting versus a private practice versus medical setting is different. Like top % of graduating students. No, that is actually the beauty of optometry. That's why I was saying that, like, once you're already in optometry school, it's really not, it's not about like grades so much anymore. It's like, obviously it's important to pass, but when you're going for an interview, they're not asking you what's your GPA. All they care about is, do you have an optometry license or not? So, because what you can do with your optometry license as a B or C student is the same thing what an A student can technically do with their optometry license. Like in terms of just the paper of the optometry license, it's the same. So you don't have to be top of your class to be getting paid more. Unless, for example, you want to go into academia. So if you want to like be part of research in optometry, or if you want to go work at SUNY, for example, or be faculty at a certain school, then in that case, it does matter. They most likely they'll be more selective in like who they hire and stuff like that. They may ask for your GPA and what was your percentile and stuff like that. It also does matter if you do want to get into residencies, if that's the path that you want to take. Then in terms of that sense, it does matter with percentile. Some practices may ask if you did a residency, and if you did do a residency, they may pay you more. So it depends, but majority of cases, like if you're not going into academia or trying to be in mostly like academia, then really doesn't matter. As long as you have your optometry license, that's all that really employers care about. Okay, I think that's the end of the questions. Does anyone have anything else? I hope this is useful. Okay, so I think we're done with the questions. It's really great to be back. Again, if you have any questions, feel free to email me. Awesome, yay, Namira. Okay, it was great to be back at Hunter, really full circle moment. And I hope this helped. And I hope you enjoy the rest of your pre-optometry journey, and just know that it is a really beautiful field. It's really fulfilling. It's really rewarding. So if optometry is the path that you chose a great, great field. Thank you. Gina, what are the prereqs for ODV? So for the prereqs, they change all the time. So you can just go on their website and see what the prereqs are there. Alrighty, have a good night, everybody.